Open enrollment is the one window each year when anyone can sign up for or switch health plans. Here's what to know.
I'm Maya, and today we're making open enrollment simple.
Open enrollment is the yearly period when you can enroll in a health plan or change your plan without needing a special reason.
For the Federal Health Insurance Marketplace, open enrollment for 2027 coverage runs November 1 through January 15. These dates are set each year by healthcare.gov.
If you want coverage to start January 1, enroll by December 15th. Enroll December 16th to January 15th, and coverage starts February 1.
Outside open enrollment, you usually can't enroll or switch unless you qualify for a special enrollment period.
Special enrollment triggers include losing your coverage, moving, getting married, having a baby, or adopting a child.
Other coverage has its own windows. Employer plans set their own dates, and Medicare's open enrollment runs October 15 to December 7.
Medicaid and CHIP are different. If you qualify, you can enroll at any time of year, not just during open enrollment.
Some states run their own marketplaces and may use different dates. Always check your state's official site.
So mark your calendar early and have your income and household info ready ahead of time. Quick recap. Open enrollment is your yearly window to enroll or switch. Marketplace open enrollment runs November 1 to January 15, with December 15 for January 1 coverage.
Outside that window, you need a qualifying life event. An employer, Medicare, and state dates can differ.
I'm Maya. If this helped, hit subscribe and I'll see you in the next one. Let's make insurance simple.